Welcome back to Ozarks Tonight. An estimated 1 in 9 adults in the United States has chronic kidney disease, and that's about 30 million people. And most of them don't know it. The numbers are even higher for those at risk of developing kidney disease. 1 in 3 Americans, a total of 73 million people. Recently, President Donald Trump signed an executive order aiming at improving kidney health in the country by making kidney transplants more readily available and getting more Americans off the wait list and removing obstacles for living donors. We are taking a look at those numbers, learning more about the causes, treatment, and prevention of kidney disease today. Morgan Simerson, Dialysis Access Coordinator at Cox Health, is here with us. Morgan, thank you so much for being here.
Thanks for having me.
So let's get started and talk a little bit more about kidney disease. These numbers are alarming. 1 in 3 are at risk and 1 in 9 have chronic kidney disease but don't know it.
Yes.
Why is that people don't know they have it?
You can lose upwards of 80% of your kidney function before you ever have the first symptom. So, the majority of those patients don't know that they have the disease.
High blood pressure and diabetes are some of the leading causes of kidney disease?
Yes, so making sure that you're followed by your doctor, diet, exercise, medication, lifestyle changes, things like that are ways to kind of prevent the progression of the disease.
Mm-hmm. So you said we lose about 80% of the function before you start seeing those first symptoms. What do those first symptoms look like?
You may notice that you're more fatigued. You are noticing some nausea and vomiting, maybe not wanting to eat or not having much of an appetite. Food may taste funny, things like that. You may see changes in high blood pressure. So those are a few of the things that patients may see.
So how can someone find out before you've reached those 80%? Are there specific exams? Should everyone be watching out for this and asking their doctor to take a look, or just someone who has diabetes or high blood pressure?
There's simple blood tests and urine tests. Those patients who are at higher risk, those patients with high blood pressure, those patients with diabetes, following with their doctor is very important. A simple blood test and urine test can be used.
So when someone finds out they have kidney disease, is it automatically a case where you need a transplant? Is there treatment? What does treatment look like?
So the best treatment is early detection, making lifestyle changes. For patients who are receiving dialysis, sometimes that is a in-center coming into our unit on a 3-day-a-week schedule, about 4 hours each time, or their home therapies daily or almost daily in the comfort of their own home.
How long can someone live doing dialysis?
We have patients that have lived for years and years doing dialysis, making sure that they are doing their treatments as prescribed and following a diet and, following with their care team. Patients can do really well on dialysis long term.
So when is it that you need a transplant? Does everyone need a transplant?
Not everyone will pursue a transplant. Those patients that do need a transplant, there are, less than 3% of patients who get a preemptive transplant or before they start dialysis. So a lot of those patients may already have started dialysis, get on an active transplant list, and that wait can be several years. There are only about 15,000 deceased donor transplants available every year. So those patients that may have no other option, may not have the living donor option, may be on dialysis for quite some time before they get that transplant. There are sort of regulations as far as who can be a donor. Even those deceased donors, those kidneys that can be donated. So streamlining some of that, changing the guidelines for those that can be donated. And a lot of times it's just difficult to ask someone for a kidney. A lot of times there is financial burden for the donor. So easing some of that, and the executive order does kind of get at that in a way that It's going to provide reimbursement for those donors for lost wages, things like child care, elder care, things like that, that would be beneficial for the donor.
What is the cost, and is some of this cost for patients or donors covered by health insurance, Medicare?
Yes, so there is coverage for the transplant. The donor generally isn't out the money. They aren't required to pay for that. A lot of times you will see crowdfunding for the donor because right now there is no reimbursement for that time that they've lost work or that they've lost, being able to pay for their child care or whatever that is when they've not been able to work.
Great information. Morgan Simerson with Cox Health, thank you so much for being here.
Thank you.
We'll have more information on kidney disease and all of the stuff we talked about here on our website. That's ozarksfirst.com. We'll be right back with more right here on Ozarks Fox.